Hi, welcome to Transformational Coaching and Consulting. This is Michael King, once again, owner of Transformational Coaching and Consulting, and we are launching our first episode of Coach or Therapist. And on the screen with me is Miss Tony Evans. Miss Evans, would you care to give a quick rundown on who you are and your background?
Sure. Thank you. I'm so excited to be joining you on this adventure. I've been practicing for about 10 years now, and I work with children's, couples, and families, as well as individuals regarding an array of different issues and topics, including depression, anxiety, trauma, self-harm, self-esteem, transitions, blended family, reunification, collaborative divorce. Those are just some of the areas that I do work in. Most of the time, I do have other areas that and issues that I deal with as well.
So you
And
seem really well-rounded.
I try to be. There are some things that I don't do and stay away from. But as a family therapist, I think um, it's important to be well-rounded because families come with tons of different issues. So yeah,
Yeah.
that's important.
And so just for everybody to know, I have known Tony, which it's really weird for me to say because I have always called her Antoinette, but her professional name is Tony. So we will go with Tony for this program. I've known her for 20 years now.
Something like that.
Yeah,
Yes.
so
Call it college days.
yeah, college days, you were focused on getting into counseling when I first met you, and by golly, you did it.
I
And
did.
I was into pretty much everything else. Um, so, but it's been great. I mean, I'm very impressed with everything that you've done to get to from college to having your own private practice. It's been very impressive and inspirational.
Thank
To
you.
watch you. But that's our background. I think we probably should go ahead and launch into the questions. We'll try to keep this relatively short. So got some long questions. We'll get to all of them probably. So
Mhm.
let's start with a short question that I think has a lot to it, but it gets to the point of what this show is about.
Sure.
What does a coach do that a therapist can't do? I don't see the point of a coach other than to make a man feel special because he can say he has a coach. So from a therapist's point of view, is there things that a life coach does that you don't do?
I think a life coach is helpful when there isn't a mental health component piece involved. And I think that's really the biggest difference. Coaches are great to help people figure out direction in life and um, weeding through the different barriers that might naturally occur in life, or the person might be inadvertently creating obstacles where obstacles don't need to be for themselves. And I think a coach is good for pointing that out because that's not necessarily a mental health component. It could be, however, there could
Mhm.
be obstacles that are there due to mental health. And I think the difference is, um, if that is coming up, I think a coach is um, educated enough to know like this piece has to do with mental health issues, and therefore you need to go see a therapist, and a therapist is going to help you have the skills and strategies to combat that mental health component. So that's my take on it. I would love to hear your take on the difference between a coach and a therapist because we've talked about this
Yeah,
a
I,
few
I'm
times.
I'm right with you. From my perspective, anytime that we're having a conversation with the client and we bump into trauma, We, I guess for lack of a better word, we touch it. We mentally, emotionally touch that trauma. And if it elicits a strong response, we know we need to bring you over to a therapist, because we're not going to be able to get you where you want to be until this is taken care of. So a lot of it, and it's this is very umbrella. A lot of it is therapist history to present. And I'm not saying that therapists don't work with the future. I'm really saying the coaches don't work with the past. All right. We're not here to get you over past things. We're here to get you from the present to your future. And I think that's a good dividing line. Also, the other thing that I want to address here is the passive aggressive nature of the question, where
I agree.
saying make a man feel special. I actually have had more female clients than male clients.
Yeah.
And it's something that I'm seeing more and more in this country. I'd say in the world, but I haven't been to other countries to see it. But I'm finding more and more women who are motivated and aspiring to have these life and career breakthroughs, and men seem to be kind of on cruise control and just kind of feeling they're in a good place, and they're just kind of stick that in a cruise control and roll with that. So
Mhm.
that's my take. We don't do therapy at all, and when we see anything that even hints at it, we refer out.
Mhm.
We'd be glad to work in conjunction with the therapist, because there may be times where what the person wants to work on with the coach can be done, even though that they need therapy as well, as long as we're working hand in hand.
Absolutely.
So
Absolutely. And I think that can be beneficial to a lot of people. There's also the scenario of someone seeing a therapist and they get to where they need to be mentally, and they just need the assistance of a coach. And so I think that is a good path as well. Do your mental health stuff, figure out, you know, what are the historic or um family oriented obstacles that come up for you, and resolve and reconcile those pieces enough that you feel ready to have some coaching and do the other things, right? So coaching, I think, addresses other components that um, mental health therapy doesn't cover
right.
sometime, right? So, because with a therapist, we have to, always be cognizant of what is this person's diagnosis? How are we going to help reduce symptoms and things like that, right? And so, if a person has gotten to that place where their symptoms are really manageable, but there are things in life that they want a little guidance and directions. They want to bounce information off of a neutral person. I mean, I think objectivity is amazing. I think it's great to have someone to bounce your thoughts and ideas off of that is not invested in a particular outcome for you, other
Mhm.
than you being happy with the outcome. And I think that combination of therapy and coaching is can be really
Yeah,
powerful for someone.
and I'll give my kudos to therapists. There's definitely overlap with therapists that can fall into coaching, because like one of the things that I really focus on is providing clarity. So I find that people come in and they have this nugget of a problem, but they've put so many variables and stories around that problem that I just
Mhm.
have to cut through all of that and say, this is the nugget. And I think therapists do the same thing. Sometimes there's some mental health issues, but sometimes it's you're dealing with some trauma, and then you're teaching them how to be more focused and kind of get through some of that unnecessary information that's really confusing them.
Yeah, I think a therapist help with clarity as well. And again, we attack it from a different angle, right? Like we will attack it from the lens of, um, you know, self-talk, for instance, right? Like we all have some self-talk going on. Is that self-talk negative or is it positive? Is that self-talk helping you move forward, or is it holding you back, right? And what are the things that you're telling yourself? I always, tell the people that I work with, the most powerful things that we hear is what we're telling ourselves, right? So whether we buy into what someone else is telling us about ourselves and take that on to be true, or do we check things out for ourselves and see whether or not that information is actually true about ourselves, right? And what do we want to do with that information? Do we change that, and make something different for ourselves, or do we recognize, oh, that is true and I'm okay with that, right?
Mhm.
So there's a lot there.
And I think coaches and therapists both have to work through emotional decision making that people tend to
Yes.
run into. It's like, and for in my mind, the emotional decision making that I run into more frequently is it's more of a motivation, but they want to hurry up and they have this almost a euphoria, and it prevents them from giving the obstacles and challenges the amount of thought that is required in order to meet them
Mhm.
headlong.
Mhm.
Because sometimes it's like, okay, these are great plans, but this costs X amount of dollars and you're making this, how are we going to get to that? And if they can't come up with the plan, they're just like, oh, the money will be there. It's like, okay, how?
Mhm.
So I think from my experiences, I run more to the positive emotion. As a therapist, are you dealing with the opposite?
Well, I definitely see emotional decision making, and I come from a lens of my training and background is cognitive behavioral therapy. So I'm always looking at that relationship between cognition, your thoughts, and then emotions and behavior, right? We have the CBT triangle, and we look at how those interplay. And a lot of times, what you're talking about, the emotional decision making, is a lot of people are going from, their an emotion comes up and then they're going to a behavior. And that behavior is sometimes problematic for themselves and for others, right? And it's causing distress, it's causing interpersonal relationship issues, things like that. And what I like to get people back to, which is more of the way things should be, and because I always say emotions should not be making decisions, right?
Right.
Our thoughts and checking out information, checking the evidence kind of thing, is what should be going on. So we want people to actually recognize there is a feeling. Then we want to check that feeling out with our thoughts and evidence, situations, things like that. We weigh all this information, and then our thoughts get to decide what actions are we going to take, right? So that's the behavioral piece,
Right.
So there's that lens.
So I think what you just described is what the people in my field call emotional intelligence.
Well, we have the term emotional intelligence now.
Right. I just think we call it
EQ.
emotional intelligence. You have the cognitive behavioral therapy. I kind of think that they're the same thing, and I
Mhm.
think that's a topic for another show.
It
Which
is. We have, we say EQ, emotional
yeah,
quotient,
yeah.
versus just like IQ, intellectual quotient, right? So,
So I'm gonna write that down right now for next time.
please do.
All right. So did you want to, are you closed out on that question, or are we?
I think this is a good segue because, believe it or not, the EQ piece has a lot to do with one of the other questions that you put on the agenda for today. So,
Okay. And which question would that be?
so
So,
you have, I see there's a question that a stepdad is asking about his
okay, the stepdad question. All right.
Mhm.
So I got that one right here. So he writes, I know this isn't really for a coach, but maybe a coach can help me and a therapist can help my kid, or is it just a boy being a boy? My 8-year-old son is the sweetest kid you'll ever meet, but when he gets mad, it's a total nightmare. He just explodes. He tantrums and tries to break things. Is this just a boy being a boy? And how do I, as his stepdad, handle it? Is this something for a therapist to handle? Do I need to see a therapist? Would a coach help me? I don't think so. It's a long, actually, like 3 questions in there. So,
Yeah, I mean, I definitely have an answer. So
all right.
I would love to
That's,
hear from you first,
oh,
though.
you're going to put me on the hook. All right.
Yep.
Um, my take is this right now, as I read it, is 100% a therapist.
Yep, I would
There,
agree.
there's anger and tantrums. A stepdad means that there's some sort of trauma, separation, or something. I don't know what happened there, that there's a stepdad involved and not the real dad. Maybe the real dad's involved and maybe it's negative. There's so many questions, but a tantrum and that type of thing, that's definitely a therapist in my world. And 8 years old, that's not a life coach bag of tricks. He
Yes.
doesn't mean life. As far as the dad, I think the stepdad, I should say. I think the stepdad should go to the counseling as well because he's going to need to learn some tools to deal with this kid that's struggling with some stuff. So I definitely think he's on the right track. I think he's a good stepdad for even bringing this up. A lot of stepdads would
Absolutely.
be not my kid, not my problem. So
Mhm.
no, kudos to him for stepping up. That's my take. This is 100% in your ballpark, and maybe at some point in time in the future, the stepdad might come to me, but I don't really think so. I don't think that's a logical step.
Yeah, I would agree. I think this is completely a therapist type of issue. Yes, we don't send 8-year-olds to go see a coach, although teens, though, I could see seeing a coach for lots of different reasons.
Mhm.
But to stick to the specific problem that this dad is pointing out, um, is that EQ piece that we were just talking about, right? So to me, from what I'm hearing, this 8-year-old has lower EQ. He doesn't have the proper tools to express himself appropriately. And so therapy would help show that kid appropriate ways to express himself. It would build his emotional vocabulary, which directly lends itself to building that EQ and expressing his feelings appropriately, which would reduce the behavioral tantrums and the explosive nature of what's going on for him emotionally. This dad could even start from a place of reading books to the child about different types of feelings and then how do people deal with those feelings. um, you're right, there's a lot to this question because when working with children, there's so many different pieces to consider because they're absorbing so much from their environment and the people that they're around. And so, one of the things I'd be curious is how is mom and dad expressing their own feelings, right? Like, was
Mhm.
this behavior modeled for this child that when we get mad, we explode, right? And adult explosion does look different than a child exploding. Sometimes I've seen adults explode like a child. But it sometimes looks different, and sometimes parents don't realize that some of the behaviors that they're modeling to a child, it translates a little bit differently because the tools that a child has is limited, right? They're developing skills as they go through life and they're picking these things up. And if, a kid sees every time, mom gets upset, she kind of, throws the phone down or slam something to a kid, that can sometimes translate to, oh, it's okay to, slam doors or slam anything that I see. I can slam my body. So it could be those types of things happening as well. I'm not saying that's what's happening in this particular
Mhm.
situation, but these are
Right.
things that I'd be curious about. And when working with a kid so young, we definitely want parent involvement, even if it's minimal, because we want that adult perspective of what's happening for the kid so we can rule out lots of different things, right? So if mom and dad aren't expressing themselves in those ways, then we know this behavioral action is probably just this child's own EQ, and we'll work specifically with that. Additionally, we want the parents' involvement because a therapist is going to see your kid once a week. Um, but the parents, you're seeing them every day,
Mhm.
and we need you to actually support and reinforce the things that we're teaching your child, right? And
Right.
so the parents need to be aware of, like, hey, this is what we've been working on with your son. Here are the things that he needs to practice. Here are the things that you can actually cue him into or give reminders, prompting, things like that, to use the skills that he's learned in therapy. So that's my 2 cents on that.
And parents often don't realize how they might be contributing, their
Absolutely.
responses, and so they need
Absolutely.
that education piece as well, right? And so you work with
Absolutely.
8-year-old, but the parent isn't correcting, and you're just spinning your wheels.
Yeah, absolutely. And a lot of times that's really hard for parents to hear if I say, okay, well, here's what needs to change to help your kid. And a lot of times it's something they're doing. And that can be really hard for a parent to hear, that I
Right.
actually have to change what I'm doing in order for my child to do better.
Right. They get
Um,
defensive. Are you calling me a bad parent? Right.
Yeah, and yeah, absolutely. Or they freeze, they're not ready to hear it. They think, oh, you're a bad therapist because you don't realize the problems with my kid. You're saying it's me, and it's not. We're never saying you're a bad parent. We're saying there's a dynamic playing out. And if we address that dynamic, things change for everyone, right? Like,
Mhm.
you're happier, your kid's happier. So,
Absolutely. And
yeah.
I just had a conversation earlier today and saying that, your kids are going to model their life after yours because that's what they see. So how
Mhm.
they see dad treating mom, that's going to be what's acceptable to them from their boyfriend and their husbands in the future.
Yep,
Right.
absolutely.
And so if you're doing something at home that's creating trauma and then the kid mimics that, he's just doing the same thing. So if you're not fixing one thing, the kid's just going to think this is normal, and it perpetuates a problem.
Right. And I think a lot of times when we're going through and assessing what is the child actually seeing, a lot of parents they don't think about sometimes what the child is actually observing. They think about, well, what have I told my child, right? I've
Mhm.
told him it's not okay to tantrum. I've told him it's not okay to throw things. But kids are always watching us. They're always watching. And it's what you're saying, it's that mimicking behavior, right? And back to what I was saying earlier, there's this translation from adult behavior to what a kid thinks it is, and what it means can sometimes be different. But if you strip it down to its core, it's you can see the connection the child has made. It's not that far of a leap, right? So
Mhm.
if I take my phone and I toss it every time I get upset about something, or I slam my fist on the desk, it's not a far leap for a child to throw something when they're
Right.
upset. It's not that big of a leap for them to, start pounding on something when they get mad. So we have to always look at what are they actually seeing. It's kind of, it goes back to that, you know,
Mhm.
do what I say, not as I do. Well, like, we need to get rid of that because
Yeah.
it is, it's so far from what is actually going on for children.
Right.
They aren't listening to what you say a lot of the times, right? Because they're trying to figure out their place in this world and how they want to show up and how they want to speak and how they want to present themselves. But there's this underlying behavioral thing going on in what they're actually seeing in their interactions with the adults that are in their lives.
So the only coaching piece I saw in this question was
Mhm.
the phrase boy being a boy, right? Because
Ah,
I think boys are different than girls. I think they have different chemical makeups and it causes them to behave differently. Boys tend to have more testosterone, they're more aggressive and that type of thing. So a boy being a boy, yeah, sometimes that happens, but a boy being a boy doesn't mean that's okay. A boy
right.
being a boy means this is how I'm behaving. It's your opportunity to find the positive outlet for that so that boy knows how to use this additional energy or aggression, how to harness that and use it for the powers of good instead of evil, right?
Yes, we always want to use our powers for good. Yes, that thanks for bringing that back up because I thought that was important too, a boy being a boy. Um, those behaviors aren't okay for anyone, right? It just isn't. So it isn't a boy being a boy. And again, how do you want your child to express themselves, right? Do you want them to go out in public and interact with their peers that way? Do you want them to go out and interact with their teachers that way? Do you want them to go to church and act this way? um so if the answer to those things is no, then it's not a boy being a boy, right?
Mhm.
I've seen girls who have this behavior. So it makes no difference, and I for me in my world. So
Right. So to stick with that, I think in our country we still have a striking problem. All right. Um, a boy striking a boy is a problem. Not too bad. A boy striking a girl is a worse problem. But it also seems right now a girl striking a boy is not a problem. And so we have this. It's this is a big problem. This is a kind of a problem, and this is not a problem at all situation in
mm,
the country.
mhm. I see where you're going with that, and I would add to that with working with children, especially over the last 5 or 7 years, it might be even 10, that there's been an increase of girls being more aggressive and actually hitting other people. So whether they're hitting another girl or hitting another boy, they're getting to these physical altercations.
Mhm.
And again, sometimes that behavior is modeled that um, it's okay to handle our issues, our problems that way. It's okay to express ourselves that way.
I
So
think it's for children, it's instinctive to hit and bite and that kind of stuff, and it's the
mhm,
parents correcting. I think, I'm 50 years old, so I know when I was growing up, the response when a boy hit a girl versus a girl hitting a boy is very different. It was
mhm,
always harder on the boy for hitting a girl than it was a girl on hitting the boy. So it became more socially acceptable if a girl hit a boy. It's also kind of sexist, not as in, girls are better than boys, but it's kind of sexist in a manner because you're kind of saying girls don't hit hard, it don't hurt type of thing,
mhm.
right?
Gotcha. Right,
So
right. So one's okay and one is not. Yeah.
right. But
Mhm.
I think when you take it at the child level, I think the striking out, the lashing out is pretty universal.
Mhm. I would agree with that. It's very kids are very um the frontal lobe of their brain is constantly developing up until 25, right? So if we think about instinctual behavior, um using our bodies is instinctual, right? And so if we're afraid or we're upset, it is instinctual to uh have that feeling come out physically a lot of times, right? So
Right.
back to this kid who is tantruming, right?
Mhm.
So he has something to say. He
Right.
doesn't have the emotional vocabulary to verbalize it to you. That's what's going on, right? But once he has that vocabulary, you'd be amazed at how kids settle down and they use that rather than using their bodies, right?
Right.
So,
So a great example of that is actually in the movie Mr. Holland's Opus.
mm,
So Mr.
that's an
Holland is
oldie.
a music teacher, right? Music is
Yeah, I
his
remember
passion,
that.
and his child is born deaf, can't hear.
Yeah,
And so dad is unable to communicate. And for a while, he's unwilling to learn to
unwilling. Yep.
communicate. And
Mhm.
then he got to see the tantrum that the boy had because it's from the frustration. He wants something, but nobody understands. Or mom took the time, mom understood, but dad didn't understand. So there's that conflict and the tantruming there. Um, but it flips around, I'm not going to spoil it if you haven't watched that movie from about 25 years ago or something.
Uh-huh. Well,
But
you
yeah,
bring up
that's
another really good topic that, I think is worth talking about. Definitely on the mental health side or for anyone who has children, is our vision of being a parent and then the actuality of parenting. Because I think we run into a lot of times this uh conflict of, well, this is the parent I thought I was going to be because I was expecting to have this type of child. And when we meet our child
mm-hmm,
and start learning who they actually are, we haven't figured out to adjust our parenting, right? So
right,
that Mr. Holland's opus, his unwillingness, right, is because there was a specific child that he was expecting in
right,
my mind. He was expecting a hearing child, right? So he
right.
was not expecting to learn to communicate to his child in a certain
Mm-hmm.
manner. And so therefore there's this conflict and tension and behavioral
Mm-hmm.
issues.
Right. And,
uh,
and there's a short-sightedness there. Because you think Mr. Holland, his passion was music and he wanted to share music and he had visions and
absolutely.
visions of his son being a musician and a composer or something along those lines. And oh, deaf. Oh, his all music is dead to him. Now there's
Right.
no point. It's like, and I like this Mr. Holland's opus because we've seen a different version of it frequently in life is when the dad has a football player dream for a kid and
Ah,
the kid wants to be a ballet dancer or a kid wants to do music or a kid wants to be in drama, right? And you have that conflict. It's like, and it's always, I wanted a man, and I got
right,
this. So it
right.
was nice to see the art side not living up to the standard, but I think we're getting into movie critique almost here. But it's really the expectation of you want this thing for your kid, and then when that doesn't happen, you almost just give up on the kid.
And I've seen parents, I'll move away from football, but out here soccer is huge. And so parents, you know, push certain sports on their children, including sports. And, God forbid the kid says, I'm not interested in that particular sport. The parents feel like they still have to force that particular thing onto their child. Again, then we have this dynamic and interpersonal relationship issue, where the kid doesn't feel understood and almost feels forced, right? And
Hmm.
there's a lot of issues that are created when someone feels that they are forced to do something that they don't want to do, right?
Oh
It's
yeah,
against their will.
that
Um,
little rebel heart starts to come out.
yeah, and it translates, unfortunately, to a lot of different areas of their lives as well. Um, and so, yeah, parents not seeing like this distress that something that they thought was good for their child or what they're expecting their child to do is actually creating harm for the
Mhm.
child. It's causing distress at a minimum.
Right. And I actually brings up another topic for another day, but the line between exposing your kids to things versus forcing them into things.
Exactly.
So
You definitely want to do exposure, right?
so we'll talk about that on another time. But I think
Agreed, because we can go on forever.
exactly. So let's do one more question,
Mhm.
and then we'll call it a day. Again, not a short question. People always like to explain the universe in their questions. I'm finding that they got to tell you the history, and then they've got to hint at a question, and then kind of throw in some other variables because they want you to side with them. So I want to give this side information to lean it in.
Well, I mean, to me, I see that as context, right? They're trying to
Right.
paint the picture so you see what they're seeing, right?
Mhm.
So I don't blame someone. I'm
I
sure
know,
I
I
do
get
it
it. I get it. But some of these, and again, like I said earlier, you can direct message us. You can email me. Um, if you would like to talk, I think having a conversation for some of these questions is the very best route. And we're able to bring you on. You wouldn't have your name shown. You can leave your camera off so nobody has to know who you are, and we respect the privacy of that. But I think we could do a better service through conversation than just by answering a question without the full context. Like the question we just had, there's so much meat behind it that we don't have access to, that we can't give a better answer other than, yeah, therapist is the way to go.
Mhm.
Anyway, so last question. Lately, for like the last year or two, my husband has been completely unmotivated at work and at home. When he gets home from work, he just checks out. When I sit with him and watch TV, his mind just isn't there. He doesn't laugh or anything, he just checks out. At first, I thought he might be seeing someone else, but at this point, he isn't that great of a catch. I'm not sure if it's me, work, or just some midlife crisis thing. He's only 37, so it's early for that, right? So does he need therapy or a coach to get him over whatever he's going through? So I fielded the last one first, so I think it's fair for you to take this one first.
Sure. So I would say this guy should go see a therapist. I think there's definitely something up if there's this lack of motivation, lack of interest in multiple areas of his life, right? I think it made sense for her to check out, oh, he's not interested in what's going on at home, so his interest must be elsewhere. But if now that she's done a little bit of that checking and realizing, wow, it's not just here, it's at work as well, something else is going on for this person. Right off the bat, I would start be interested in checking for depression, just because of some of the key things that she's already indicated point that direction. Um, but he could use a coach. I don't know. Like he could go into therapy. I'm just gonna say yes because I'm a therapist. So I'm like, everybody should get into therapy at some point. It's
Well,
just good to
I
do so.
I prescribe to the philosophy that in the course of someone's life, everyone needs a coach and a therapist. Not necessarily at the same time, but at some point in your life, you need to have a coach with you. At some point in your life, you need to see a therapist to help you get through some other things. Because life isn't easy.
Mhm.
People go through trauma. People go through, separations and things of that nature. And a therapist can help deal with that and fix some of those blocks that develop. Some of those, I think there's behaviors you don't even realize you're doing because you don't know why you're
Absolutely.
doing it, right?
Yep.
Um,
Absolutely.
so I can see that for this, and because this guy right here, he can go. In my mind, he can go either way. Um, I don't know what he does at work. I mean, if he is working an assembly line and he's bored,
Right.
does he have a PhD in chemistry and he's working the assembly line? He's just not
Right.
challenged and that kind of stuff.
Right. Yep.
Um, I want him to see a therapist because I struggle with his wife. I Oh, maybe because I'm a dude, I'm going from a dude perspective here, but she doesn't sound like a good catch because of the fact that she said he isn't one. So there's something not being supported at home. You know?
I want to say that her comment was strictly that he's not going anywhere, he's not doing anything, so there's nothing happening in that department, so to speak. So that's where I'm going to come from
Right.
with that. Yeah.
So
So
I don't know, but um my thing is the fact that she felt compelled to write that in there and it wasn't even important to the situation, that because you could get the point without saying
yes,
he's not a great catch. So
absolutely. So yes, so there, I agree with you 100%. There is something going on in their dynamic, in their relationship, that probably needs to be addressed as well. Because yes, she didn't have to say that,
yeah, and
but
she's
she
probably got
did.
some frustrations. I mean,
Yep, exactly. Right. So with that said, they should both probably get into therapy. I would say,
yeah,
and a case like this is, both people might need their own individual therapist, and they have a couples therapist to work on the relationship dynamic, right? And
yeah,
back to what you were saying before, but with the coach or therapist kind of, um, question, do you do those things concurrently, or do you do them separately, right? And
hmm
the answer is it depends.
yeah,
So it depends on the situation and what each person has going on. Because if he is truly depressed, there's going to be a lot for him to work on and do before he can actually address the relationship
right,
aspect
and,
going
and
on,
work.
right? Like
And
he's
there's
got to get well in order to be well for his wife, right?
exactly, and as a coach, I can't help him yet,
Right.
right? And I look at this, and the first thing that I see is a complete communication breakdown. I mean, they've ceased communicating it, and it seems like she's tried to communicate and he's
Mhm.
not responding, and we need to know why he's not responding.
Right.
Um, and again, this becomes like more of a conversation thing. How does she try to communicate? I mean, is her method of communication is just straight to nagging, or is it inquiring and he's not responding? Because that can be two different things. Um,
Mm-hmm.
so this could be a coach thing, it could be a therapist thing, it could be a therapist then coach, it could be concurrent. We just don't know.
Mm-hmm.
Um, the work side, a coach can definitely um, look into that and see what's going on there.
Mm-hmm.
Um, but I would focus at the beginning on the communication and the obstacles to communicating. Why aren't you communicating? What? Because usually when someone isn't communicating, um, they fear a response. Either not, they're going to be violent, or the consequence of it, right? Like, I don't want to talk with you because you're going to X, or you're going to think X of me, or, so there's a consequence that they don't want to deal with. So they just don't communicate.
Yeah, sometimes. And I think sometimes too, if you're talking about depression, the person isn't aware of what's going on with
Mhm.
them necessarily. They don't know um where it's coming from. Sometimes it feels like it's coming out of the blue for them, and they don't know how to articulate that. They just know something's wrong.
So
Um,
I'd like to touch on that. Can you, because I think the word depression gets thrown around a lot, just like love and hate. It's almost lost the meaning in a sense. I
hmm.
think I think sometimes people are just sad and they use the depression word instead. So I think maybe this would be a good time to clarify depression.
Sure. Depression includes sadness, but if the sadness is pretty pervasive, like it is going through most of your day, most of your week, um, there's a preoccupation. Well, it's not a preoccupation, but that feeling is just pervasive, like in this example, through all the different areas of your life, right? So there's this lack of interest in things that you found pleasurable. There's withdrawing, being isolated. Um, Maybe you're not feeling as motivated or engaged. So back to that pleasurable, the things you find pleasurable in life. How long has this sadness been going on? Are we talking about the last couple of days? Or are we talking about the last 6 months? There are a lot of other symptoms also with depression, but it's a grouping of different criteria that comes together to make up depression. It is not just sadness. Sadness is part of the equation, but it's only one part of the equation.
Right. Thanks. Because I just feel that I've heard people use it so often, and it's like, depression and clinical depression is pretty serious,
Mhm,
whereas sadness is, it's unfortunate, but it's also something that can strengthen you. And
mhm,
I don't think you get strength through depression.
mhm, I would agree, and I think also the distinction between how does depression come about, right? The way I look at it is there's depression through a chemical imbalance, and then there's depression through um, environment or situational, right? Like there are definitely things like trauma that create depression, grief and loss that create depression. Um, Interpersonal relationships and lack of satisfaction in relationships that can create depression, and figuring out where the depression is coming from, whether it's this organic piece or this environmental piece, is actually really important as well,
Okay.
because they get addressed differently a lot of times.
Right. So, um, so depression, by finding the source and correcting that source, can be corrected. Right?
I if it's organic, right, the chemical imbalance piece, there's definitely medications that help with that and
Hmm.
help to even someone out. And yes, they can see great change in their symptoms and have minimal episodes. If it's, situational or environmental, there are definitely skills and strategies that people can learn to help with that. And also if it's organic, you still have to learn the skills and strategies. I don't want to say just go get a pill if it's organic, because I don't believe there's no one pill that's going to like be the magic bullet and fix
Right.
everything. You still have to learn how to manage your symptoms and your feelings, and be mindful and catch them when they're coming on. So environmental, situational, there are definitely lots of things that can be done, especially if there's trauma based um depression. There's a lot to process there and to unpack that someone needs to do in order to feel some relief.
So, to dive into this a little bit more, what happens if you just give a person a pill when it's an environmental based depression?
They typically won't see any difference. And
So, so they'll just still have the depression, but they'll have like the side effects
so
of
they'll
this
have
pill,
they'll
or
have some improved mood,
okay.
but so they'll think, they won't feel as sad. But what a lot of people come into therapy and they are already on medication, and they'll say, well, it's not working. I don't think it's working, and the doctor has increased it.
Mhm.
And it's like, okay, well, tell me about your life and what's been going on in your life, right? And then working on those pieces. And a lot of times you do find it's trauma, it's relationship issues, things of that nature. Or again, back to that self-talk or self-esteem. Also, there those components that play into things depending on where the person is in their life. A lot of people go through life thinking like, oh, there aren't these issues and they're fine. Almost like that cruise control you were talking about that guys can do sometimes. And then you come to this place in life where there's a lot going on, or it calls attention to a problem that's kind of just been sitting around in the background. And now you have to address it. It's in your best interest to address it. Otherwise, you're going to experience some level of distress around it every time you're in a certain environment, or you're with a certain person, or you have to do a certain task, you
Right.
know? So, yeah.
So I view it as kind of like a wound. All right.
Mhm.
If you cut yourself, you can get a shot to numb the pain, but that shot does not stop the bleeding. So until that bleeding is addressed, you may not feel something, but you're still going to bleed out, and you still, as long as you're bleeding, you have the chance of death, right? So if you don't
Mhm.
address it, things are going to continue to deteriorate.
Yep. Yeah, definitely. So do you think we answered that question well
Um,
enough with what we know?
yeah, I think that answer was D, all of the above. So
It is
it could,
all of the above.
yeah, it could be a therapist, could be a coach, it could be both, it could be one after the other.
But as a coach, where would you recommend the person starts? Would you recommend, hey, try a coach first, or try a
I
therapist and
would,
rule out some stuff?
it would depend on the situation. So first, who they're most comfortable with. All right. So if for some reason they know a person who has a coach and they want to use that person's coach, and that's who they're going to talk to, then start there.
Mhm.
Um, if they're gainfully employed with a good medical plan, financially, it might be best to start with a therapist, because you got insurance coverage that's going to cover that, where insurance doesn't cover coaching. So it
Yep.
might make financial sense to start with a therapist, but ultimately, um, go with where you're most comfortable talking, because it doesn't matter if it's a coach or a therapist. If you're not honest, you're not going to have resolution.
Absolutely. Thank you for saying that. Be honest about
Yeah,
what's going on with you.
yeah.
Yeah.
It's both is confidential. The therapist is more confidential because of the HIPAA laws and that type
Mhm.
of thing, patient, client, doctor, patient privilege type stuff, where coaches don't have that same protections. Maybe that happens in the future, maybe not, but um, I know from our ethics that we agree to, we don't talk about who we're coaching. So if I was coaching person B and we were out at a party together, and we could hang out and talk, but I would never say I'm this person's coach. It'd
Mhm.
be like totally taboo. That person can say, "Oh yeah, this is my coach, Mike." Then it's fair game. But even then,
Mhm.
I'm not talking about what I'm coaching them through.
Right.
I'm just saying, "Oh yeah, in case they introduce me as such, I will own up to, yes, I am this person." But we don't
Mm.
go into the details.
Well, we
So
know you've coached me through some stuff, so oh, I will acknowledge you as my coach.
um, that's all right, because I think knowing each other for so long, we've helped each other through all kinds of things.
Yeah.
So
Yeah.
um, put each other through all kinds of things too, I'm sure, but we've helped each other through all kinds of things.
Uh-huh.
Um, but yeah, you've got nothing to lose by being honest with your coach or your therapist. You have the whole world to gain, absolutely nothing to lose. There is strength and vulnerability and pride and ego are obstacles to health. That's really it. I can't sum it up any better than that.
I love that you just said there's strength and vulnerability, especially coming from a guy. I love hearing that. Like, because I believe that for sure. Like, it is why people are so scared to be vulnerable, right? Like, you have to be strong to go to that place.
And so now you get me onto another tangent, and we'll just have to close it at that. But let me talk about strength. All right. People have these weird ideas of strength. All right. Strength is merely doing what is difficult. All right.
Yes.
That's it. It doesn't matter
It's
what
not
the topic is.
complicated. Yeah.
If it's 100 pounds is difficult and you do it, there's strength. If crying in public is difficult and you do it, there's strength. If
Yes.
admitting to something is difficult, that's strength.
Yes.
What's the opposite of strength? Weakness is when you won't face up to something challenging. Right? So that's weak. You don't have that fortitude yet to address it. And you can get encouragement to do it, but nobody can give it to you. That is something you've got to do yourself.
Absolutely. Yep.
So that's my little rant on strength.
I love that. We should end on that note. I think it's a very strong note to end on.
All right. I agree with you. We will end there. Thank you for coming on, and thank you for doing Coach or Therapist with me.
Absolutely.
It's something that I've wanted to do. It's something I wanted to do. I'm glad I roped you into it. And so people watching this, please reach out to me. Want to have questions, love to have a conversation. If you're watching on YouTube or whatever, give it a like, hit that notification bell so you can get notified for the next episode of Coach or Therapist, and tell your friends. Everybody has friends who need help, and the fact that you have friends that need help means that they have friends that need help, and you might be one of them. All right. So thank you again, and we will talk with you all very, very soon. And as always, peace be the journey.